The International Red Cross says hospitals in Mekelle are struggling to care for the wounded, with medical supplies running low.
In Mekelle
Well,
visited one of the major hospitals in the city on Saturday, and what they found was a pretty dire picture. On Saturday, the team at the hospital estimated that about 80% of patients there were suffering from trauma injuries. And it was this influx of the injured that basically forced the hospital to suspend many of its other services to care for chronic medical conditions, to really dedicate what resources they have on providing emergency and life-saving assistance. But probably what's most alarming is the fact that this hospital seems to be running very dangerously low on medical supplies. And when I say medical supplies, I mean really basic things, things like having gloves, antibiotics, painkillers, drugs that are really important for surgery for trauma wounds, like anticoagulants, which help with blood clotting and to stop with bleeding. And our fear is that if hospitals like this one don't get medical supplies soon, they could be soon unable to care for the injured, let alone the many other chronic health issues that haven't gone away because there is now fighting. These are trauma injuries, so these would be wounds connected to fighting on Saturday, and a lot of them would require surgical care. I guess another point to bring up in terms of a need we found is the hospital is also low on really basic things like food as well. Patients now that would be recovering from post-op care would have a very nutritionally limited diet, which also isn't good for their recovery. So while the situation in the city was calm yesterday and it seems to be calm today, our teams are able to move around. I think what we saw on Saturday is probably indicative of a wider need of hospitals and healthcare facilities around the region. This is something that we also saw in North Amhara a couple of weeks ago, in hospitals and healthcare facilities that received injured people in that very first week of fighting. They too were running low on medical supplies, and we were thankfully able to get them some help. And we very much hope to be able to do the same for Mekelle soon.